Hello, today we are going to study about IV fluids. As we all know that IV fluids are very commonly used in our day-to-day practice, so proper knowledge and understanding of them is very important. IV fluids are of two types, sanguineous and non-sanguineous. Sanguineous means they are derived from blood and non-sanguineous means they are not derived from blood. Non-sanguineous fluids are of two types, crystalloids and colloids, and we are using both of them regularly in our practice. So what are crystalloids? Crystalloids are basically fluids which comprise of water and electrolytes. Crystalloid solutions are aqueous solutions of ions, that is salt, with or without glucose. When we use crystalloid, we have certain advantages. They are very less expensive, they are easily available everywhere, and crystalloid solutions rapidly equilibrate and distribute throughout the entire extracellular fluid space. But crystalloids are having certain disadvantages also, like they are having shorter IV life and their duration of action is also very short, which is about 20 to 30 minutes. Crystalloids are usually considered as the initial resuscitation fluid in cases of patients with hemorrhagic shock, septic shock, in patients with burns, and in patients with head injury. In these conditions, crystalloids are considered as initial resuscitation fluid. Our first crystalloid is ringer lactate. Ringer lactate is very commonly used in our day-to-day practice. It is a crystalloid, a replacement maintenance type of crystalloid. It is isotonic in nature. Its osmotic pressure is 280 milliosmol per liter. It is having sodium, potassium, calcium, chloride, and bicarb as lactate. Ringer lactate does not contain any dextrose. What are the uses of ringer lactate? The main uses, it is electrolyte composition is similar to our plasma, so it is an excellent replacement solution. Ringer lactate is also called poor man's blood, and we can use ringer lactate as an intraoperative fluid and in cases of hypovolemic shock, in cases of burn, trauma, GI fluid loss, acute blood loss and dehydration. So ringer lactate has varied uses. Its disadvantage is it contains lactate, so it has to be avoided in cases of acidosis. Our second crystalloid is normal saline. We are also using it in our day-to-day practice. It is a crystalloid. It is a maintenance replacement type of isotonic solution. Its osmotic pressure is 308 milliosmol per liter. Normal saline contains two things, sodium and chloride. Sodium is in concentration of 154 milliequivalent per liter and same is chloride. What are the uses of normal saline? Normal saline is used as a replacement fluid as it is isotonic. Normal saline is also used as irrigating fluid and to clean body cavities. When patient is mildly hyponatremic, we can use normal saline to restore sodium levels. We can use normal saline in diabetic patients. Normal saline is very commonly used to dilute the drugs or to dissolve the drugs. But normal saline also carries certain disadvantages. It is having sodium in high concentration, so we have to use it with caution in hypertensive patients. Normal saline can also lead to overload, and excess amount of normal saline can cause hyperchloremic acidosis. Our third crystalloid is DNS. DNS is also used in day-to-day practice. It is a crystalloid. It is a maintenance type of fluid. It is having osmotic pressure of 585 milliosmol per liter. Each 100 ml is having 5 gram of dextrose and it is providing 20 kilocalorie per 100 ml. We are using DNS in hypoglycemic patients because it is having dextrose. It is a replacement fluid when other fluids are not available. Another important feature of DNS is that it is a component of total parenteral nutrition. We can use it in cases of hypernatremia and hyperkalemia, dextrose along with insulin. But DNS also carries certain disadvantages, like because it is having dextrose, which is sugar, So it should not be used in diabetic patient, and also DNS has to be avoided in head injury patient. And after absorption of dextrose, DNS acts like normal saline. Another fluid is dextrose in water, 5D, 10D, 25D. It is a crystalloid, maintenance type of fluid. It is hypertonic in nature. Its osmolarity ranges from 285 to 556 milliosmol per liter. We can use it for water replacement and for nutritional purposes. But important thing is, when we are using dextrose in water, we have to monitor blood glucose levels. That's all for today. I hope you have understand about crystalloids. Thank you.